At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live. Hello and welcome. My name is Donna Cryer. I am the CEO of the Global Liver Institute, and I have the honor and privilege of doing, frankly, one of my favorite types of episodes for GLI Live, where we are able to spotlight our Liver Action Network members, to be able to uplift the work of other liver advocates, of those, frankly, who were doing this long before I was in many cases, and are doing it so well, is really just an honor for me. And I have just the embodiment of patient advocacy in this field, Suzanna Masartis from Community Liver Alliance. Suzanna, good morning.
Good morning. Great to see you, Donna.
It's always great to see you. I always learn so much and am energized. And for those, of course, who couldn't join us before we started filming, I didn't have the smile on my face. Susanna put it there, and with her energy and her passion. And so I'm already grateful to you.
Well, I'm grateful to you too. Thank you for the opportunity to feature the Community Liver Alliance this morning.
So you are celebrating the 10th anniversary of Community Liver Alliance. So tell that story, and then we'll back into your personal story and how you got engaged in all of this. But 10 years is a very special milestone.
It is. It's gone by so quickly too. We've been having a great time here at the CLA. So, we've accomplished a great deal, and we're celebrating our 10th anniversary this year. And I was looking at our retrospective, writing the timeline, and it was so great to look back and to see how far we've come, because I know you and I have known each other for all of that time, and we have a similar personality type. I thought we should have done so much more by now. Right. But then when you look at what you've done, you're like, holy cow. And, the strength of the CLA, particularly over the last 10 years, has always been the people who create our organization, that support our organization. It's not one or two people or staff members, it's the, you said, embodiment of, that greater cause. And so it's been amazing time, and we're planning celebrations, and our awards luncheon is happening next Friday. And we have brought back all of our founding board members to honor them and recognize, their being the impetus of what we're doing. And, it's certainly our time in liver.
That's amazing. That should be a theme. I want to make sure we capture that. It's our time in liver. We have been able to see so much improvement where, and I know so many patients and caregivers don't necessarily feel it. We're changing that. But for those of us who have been involved, we've gone from, negative awareness to some awareness, and to people starting to recognize the importance of liver disease. And I certainly, when I wake up in the morning and I read a newspaper and it's mentioned, that we like, okay, the first step is done. They're at least in the conversation. And so that has a lot to do with your work and the work of, several other people as well. Across that 10 years, what have been some of the milestones? What are the things that you stand back when you do that retrospective and you're like, okay, that was a pivotal moment. That really, changed something, or that was something that had powerful impact?
I look at the pandemic, and that's when we really grew. And, while other organizations were, closing offices and eliminating staff and programming, and that's when people needed it more now than ever. Right. And we're able to expand the staff and our footprint across the nation and simply across around the globe. We've reached over 30 countries through our mission. And so, if I take away something from the pandemic and was our growth and being able to, expand through technology and, reach a greater number of people and, really shore up the mission of the organization. So, that was just really a great opportunity for us and to learn so much. We, we did a strategic plan to better understand how are we going to remain relevant and responsive in this liver space, because we certainly weren't able to do the things that we always did. So we knew that we needed to continue to be nimble and clever and entrepreneurial, similar to the GLI, and really thinking outside that box and being creative. And we know our liver space is small. Everybody knows each other, but the greater audience needs to know who we are and about your livers and liver health. And I think that together we're really bringing down that stigma by having a larger voice.
I think that's so important. And that's why I am always honored when someone joins the GLI Liver Action Network, because, you didn't have to. You could go in on your own. You're very talented, you have wonderful ideas. But, what value do you derive from being part of the larger network?
That's a great question. And, our mantra at the CLA is we're stronger together. And we firmly believe that, it's important that we all support each other in this liver space. And, the Liver Action Network allows us an opportunity to collaborate with our colleagues in this liver arena, and that we can focus on not duplicating efforts, working towards goals together. And again, supporting that wider liver community, through all the good work that we do, because we all have our strengths, as you mentioned. And, the policy piece is important. Education and awareness piece is important. And if we're all able to have, that larger voice, we can really accomplish all of our missions together. And so, and learning from each other, it's been a really great opportunity for us to expand as well and learn.
I'm so glad to hear that. That really is the motivation behind it, to help give an infrastructure for advocacy in liver health across the United States, and to be able to lift up the community organizations that do it, to make things easier, to make best practice sharing, faster, so everyone can, be elevated and be more effective. And so I'm really so glad that you're part of it, and so glad that you're deriving value from it. And certainly, your expertise in policy is something that is very valued by the group. I know, although I sit here in Washington, D.C. most of the time, we also have a home in Pennsylvania. And so when I see, ads featuring liver disease and liver patients in Pennsylvania, about state policy, I know you're behind it. And I'm cheering you on. And so tell us a little bit about how you've been able to be, effective in state policy, where that's been something that I know has been a tough, code to crack for so many.
Yes, thank you so much. We appreciate the opportunity to feature we lead some legislation in Pennsylvania currently. We have a House bill and a Senate bill on non-medical switching, Pennsylvanians for Fair Health Coverage. We also were able to pass Act 87 in Pennsylvania back in 2016, where baby boomers are offered a hepatitis C screening by their primary care physicians. And we work with our colleagues across the state and across the nation and other states to bring down barriers for patient access. That's one of our, very important policy priorities, is just bringing down those barriers, allowing patients access to, make sure that it's fair for patients as well. We know that there's disparities that exist within liver diseases, but it was even more apparent during the pandemic, when people were, cloistered and they weren't able to, access the important health that they need. And so, we're really working towards, through our strategic plan, to really create health equity through policy, through education, through, raising that voice of the liver patient and centering the voice of our liver community in our state and across the nation by, again, banding together. Coalitions really can inspire positive change. And it's just like how I think about, how does a river get through the mountain? Because it stays course. It doesn't stop. Right. And we don't stop. And, our liver community is mighty and tenacious. And so, and the GLI helping to lead a lot of the policy pieces, our endeavor to have a listening session with the FDA together to, make them aware that, we have to think about the patient every single time. We're developing therapies, that we're creating laws, that we're, thinking about health insurance. So we have our work cut out for us, don't we?
We do. I think that, the process of creating success in these different areas, in attracting state lawmakers to get to the stage where you have bicameral legislation, is often what's needed to younger advocates. And so to have someone like you being able to be part of the LAN and our A3 and other initiatives, to be able to share, because you're right, those same issues pop up in Oklahoma, in Tennessee, in various areas of the country that we're in contact with, and they just really need to know how. They're passionate about the end result of causing the change, but the knowledge about what that path is and what that process is and how someone has accomplished it before. So being a model for that is so important to creating, a generation of effective liver advocates. And so, the impact of what you've done, of what you have done and what you are doing, can carry so much further when we give it that exposure. So it's really exciting to be able to do that, just as I have been able to, share my regulatory experience with you and with others, so that we can all be more effective in that area, because they're all important to us. You have several really creative initiatives that I want to make sure that we touch on, such as your Learning Labs program. Can you tell people about that?
Sure. It's such an exciting initiative. So, there is an intersection between liver disease and harm reduction. And harm reduction is more than a syringe service program or, an MAT site. It's about prevention too, and it's about education. And we can't have viral hepatitis elimination without harm reduction. And so we've done a really great job of working with partners. And again, it's about the partnerships, and it's not one organization that is making an impact. And so we received a grant through the National Harm Reduction Coalition's Connect initiative, and we created this leadership learning lab. So our role in harm reduction is the education and the support. And so we created the lab to educate and support and invest in the individuals who are doing this great work in our states and our communities, and it's life-saving, and it's very grassroots too. This work is a passion for people because it's misunderstood, and there's a lot of barriers to bringing this work to fruition. So we educate on 5 core competencies, all about business basics and personal branding and communication, and really understanding budgeting and fundraising. And so it's a year-long online endeavor. We have modules, and we're actually taking applications right now. I'm going to plug it.
Okay, great. We'll include that information.
We will, definitely. And so at the end of this, we have special speakers. Every cohort, each individual has a mentor that they're paired with. And we have a summit that we bring everyone together. Last year we were in Pittsburgh, and we had special speakers and networking and just an opportunity to educate each other. And so it's really important because, it's people know about harm reduction who are in harm reduction, but these people have to be able to pivot and remain, again, responsive to policymakers, to law enforcement, to first responders, to academia, to healthcare. And so we want to make sure that, they have that education and that support. And then we also host every other month, a HCV provider network through that to, bring providers together, especially FQHCs. And so the Learning Lab is supported by this group of people. They're part of our speakers bureau and mentors and planning committee. So we had our first one last year. We're gearing up for our second one. But I think the most important piece of the Leadership Learning Lab is, the value of people and letting these people know that they're important and they're worth to invest in. And so is their work. So through the application process, they pitch a project that they want to support or do more of. And it could be anything to help their organization, even something like a donor database, is new to them. So we also invest a stipend of money grant back into these organizations because it lends credibility to other funders. They're worth investing in. This is important work. And, we just want to be able to expand and sustain that good work across the nation.
That's fantastic. And those are exactly the type of, as you said, grassroots initiatives that are really touching people that we like to, point out to the White House when they're, asking about viral hepatitis elimination programs. It's not as if they're not being done. They just don't have enough attention, enough funding, and enough support. Right. And so, what could you do if you were, supercharged with, with funds? You have all these wonderful ideas and the trust and faith of your community. And so those are the types of things that we want them to know about and to support. And if we can better, stitch them together into a national, fabric, it's not as if we're starting from scratch. There's been this long investment of hard work that's being done and has been done for a long time. So, kudos to you.
Thank you.
What are you looking forward to in 2023? You told people about, your strategic planning process. And I really want to underscore, the value of that and the professionalism that you've brought to this field in doing that really thoughtful process. I mean, so often there are people who are of, very good intentions and they just sort of start, but as we know, it's very complex. There are a lot of areas of liver disease to be able to address. There are a lot of ways that they could be addressed. And so, I think it's also, I just want to, make sure people understood that you're choosing these priorities based on a very thoughtful strategic planning process. So as a result of that, what is exciting about 2023 that we should watch?
Well, it is an exciting year for us. Through the strategic plan, we identify, and it was a different model. We hired a strategic planner and we embraced the theory of change. So we knew where we wanted to go, and now how do we get there? Right. And so we involved all of our stakeholders, internally, externally, and many different methods of gathering information. And so what we understand, and something that's new and exciting for this year, is how can we affect the disparities that exist within liver diseases for people who experience liver disease. So we're having our first Addressing Disparities in Liver Diseases conference on April 18th. And we have a diverse and amazing planning committee. And we always involve people with lived experience for our planning. We lead all of our patient education with surveys. We want to know, what do you need? What do you want? Tell us so that we can better serve you. We don't want to presume to know. And I know you understand that better than most, being on both sides as a leader and a patient. So, we really do put our money where our mouth is when we talk about centering the voice of the patient. We really do listen. And so our Addressing Disparities in Liver Disease conference will be virtual. And it's really a great model because, it's a half a day and we have a patient and a provider and 4 main topics that our planning committee decided to embrace: viral hepatitis and harm reduction, liver
Mm-hmm.
cancer, NASH, and access to liver transplantation. And we know that, just anecdotally, what happens out there, but we want to hear, and we want others to hear. We want not just people who are in public health, we want people who are in policy to listen. We want the policymakers, we want the payers to listen, the health systems to listen, because we can affect change if we work together, but really listen to each other. So the first part are panels of patients and providers describing the disparities. And then the second half of it is breakout groups thematically with those 4 topics. And we will figure out ways to, strategies to address and, remove these barriers to really affect not just health, equity, and justice, but is racial health and equity and justice. And we look at these marginalized populations, and we know that we've done so much in this 10 years, and the work that you are doing and the others are doing in this liver space, individually and collectively, but we have such a long way to go still. And, we know that it's stigmatized. So if we can, put faces and names, and it could be any of us at any time. So, we're really excited about this. And so we'll have a summary. We're going to publish the outcomes. We're going to have actionable items that we're going to follow up on. Do we need to create an awareness campaign? What is out there that exists that we can, use, and then not duplicate efforts? And what can we create together? So it's going to be really exciting. And we hope that you and your organization will be a part of it, and, help us to have folks attend and talk. It's very interactive, and we want to know, what you think and how can we, better address these situations, because as far as we've come, it's our time in liver right now. And I can't say that enough. And, I've been in this space for 18 years, a better part of 20 years. And so seeing nothing for so long, and that now there is something, we have to keep that momentum building, and we have to be able to help these people that, it does exist, where you live, your education, if you're LGBTQI, if you're people of color, and so on, rural. And so there's a lot of work for us, but we know we can chip away at it. Again, that river cutting through that mountain, we're not going to stop. And we're going to, really remain relevant in this space to center that voice of people.
I so appreciate that, because I know that you mean it and do that with intention, and that your activity and your report will truly reflect that, that it's not just, a slogan for you. So as a patient, I really thank you. And I just encourage everyone listening to this and to really explore, the links and materials that we send out about Community Liver Alliance and your First Health Equity Conference, and all of the things that you have planned in 2023. So, GLI will be there to support you as one of our fantastic LAN members and one of my personal friends and partners in this great endeavor of liver health.
Thank you.
So thank you to Suzanna, and thank you to everyone listening. You can have the last word if there's something that we have left out or you want to make sure people remember. I just love your theme that it's our time in liver.
Thank you. Well, I guess it went by so quickly. I'm having so much fun with you. We have our Delivering Hope campaign that we created last year. And, I just wanted to note that, people will see what we're doing about addressing disparities. Again, this awareness campaign helps us to educate the wider community, not just the liver community, but people who don't know about GLI or CLA or some of the other organizations. And it's also a fundraising activity. We sell sunflowers to raise money. So educating people, selling sunflowers and bringing some sunshine to others, and, making liver relevant, and, making people aware that they should love their livers. Right.
I think that is wonderful. I too try to focus on the joy of life that can be when we all get together and we get this right, whether it's having medications available and true access, or transplantation available, or preventing liver disease as a whole. There is reason for hope, and I'm so glad that you are focusing on that. And sunflowers are some of my favorites, so we'll definitely be supporting that. Fantastic. Thank you so much. And thank you to everybody who's watched today.
Thanks, Donna.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.